Good day, dear friends. With you is Natalia on the channel Dr. Savkina, on which I share my personal experience and answer your questions. Quite often in conversation with patients who have been prescribed chondroprotectors for joint treatment, you can hear such a phrase. I took it for 2 weeks and didn't feel any effect. What effect exactly are we talking about? After all, the group of chondroprotectors are slow-acting drugs, the effect of which does not appear immediately, but gradually and imperceptibly. Improvements in well-being can be discussed in terms of months and sometimes years with their regular use. What are chondroprotectors? This question is most often asked by patients during my consultations. First of all, it is a building material for the cartilaginous and connective tissue of our joints. A large role in the functioning of the joints is played by the synovial fluid, which moisturizes the cartilage. In other words, it is also called lubricant. With age, its quantity decreases and it loses its viscosity. Because of this, one can only dream of easy sliding in the joints. So, joint treatment preparations are made from natural materials, from the bristles of pigs, cows, deer, mollusks. Their components help restore the normal condition of joint lubrication. For example, glucosamine protects bones from calcium leaching. In turn, chondroitin normalizes the phosphorus-calcium balance. Chondroprotectors start working not immediately, but have a cumulative effect. Moreover, they need to be taken for a long period of time. To this day, rheumatologists prescribe chondroprotectors of 3 generations. The first is extraction from animal products, which include chondroitin and glucosamine. The second generation includes the same products, distinguished by faster absorption and not causing allergies. And combined preparations, which, in addition to chondroprotectors, also include anti-inflammatory components. As practice shows, patients prefer capsule forms of drugs, which are better to take during meals, focusing your attention on this. So one of the most popular chondroprotectors that deserves attention is the drug Dona. It really works, which is confirmed in practice. Taking the drug allows to restore the cartilage tissue and relieve the pain syndrome, although it does not cure inflammation. Pioskladin, which contains avocado oil and soybean pulps in its composition, enjoys authority among patients. It promotes the synthesis of collagen, relieves pain and inflammation, and also reduces the production of enzymes that destroy cartilage tissue. It should be taken 1 capsule a day for 6 months. As practice shows, the drug is quite effective for restoring mobility in the joints. One of the favorite drugs among many patients is Teraflex, which contains 2 components in its composition, chondroitin, sulfate, and glucosamine. You might be surprised, but this drug works even at the 3rd stage of osteoarthritis. Its effectiveness is noted in cases of destruction in the cartilage tissue against the background of trauma or systemic disease. It is quite easily absorbed and does not contain any unnecessary components in its composition. Moreover, many patients note a long-term effect after the end of the treatment course. The attention of many doctors today is drawn to the Triactive Artron preparation, which contains the same substances as Teraflex, but with the addition of a special component, methylsulfonylmethane, which contains sulfur in its composition. The drug, as its manufacturers position it, is active and effective in osteoporosis. It is prescribed for a wide range of musculoskeletal diseases. It is quite well tolerated, characterized by the onset of quick results when used, but it is one of the most expensive chondroprotectors. Members of my family use the drug quite often. From my point of view, it effectively relieves pain syndrome. as the manufacturers claim, it contains tissues of marine organisms in its composition. Sharks, rays, squids, and salmon, the activity of which is 50 times higher than that of other artificially synthesized drugs. Indeed, the last time, exactly a year ago when I took this drug, it had such a stinky smell that I couldn't finish it till the end. At the same time, I even doubted its shelf life. But judging by the label, it corresponded to the manufacturing date. There is a whole range of chondroprotectors for intramuscular and intra-articular use. That's a topic for another time. We will definitely talk about it with you in one of the following videos. You were with Dr. Savkina. Subscribe to my channel so you don't miss many new, interesting, and useful videos. And be healthy.